I loved the duality of a challenging environment that was safe enough for you to grow. So you feel encouraged to go beyond your comfort level because you know there's always a safety and accessibility of mentors that are here to guide you along the way. So you're not afraid of pushing beyond your boundaries.
Just understanding that we're all here in this together. You're not on your own. We're gonna work through everything together. One of my interns is doing our first admission. We walk through it step by step, showing what I learned and all the mistakes I made, and kind of passing that on earlier so they can have a foundation to have their own experiences and create their own style.
When I first started off intern year, I was on the wards, and both me and my co-intern were managing this really complex patient, and coming right out of medical school, it was overwhelming. What I always remember was that we had all these different consult services helping us, and fellows on all those services would go out of their way to help us. The fact that they took the time out of their day to not only talk us through that and walk us through the care of this patient, but then also give us words of encouragement really stuck out to me. And that's something that, just really emulates the personality and the culture of this residency.
The support in this program really starts from the top down. And, for me, my assistant program director is Ross Hilliard, and he and I have meetings where I explain how I am so unsure about what I want to do career-wise or even personally, and he really takes each part and we talk through it. And then you get to, the chief residents who also have a similar policy of knock on our door, send us an email, we'll set up a time, or, just come by and we'll talk through whatever it is that you need to talk through. And then from your co-interns, we have group chats, we have a lot of camaraderie in the program.
At the beginning of residency, we had 2 weeks of orientation where we got to know our co-intern class really well, and we all get along really well. What's nice is that most of us live in Providence near each other, so it's really easy to coordinate going to do activities on days off or meeting up after work. It's really nice to be able to decompress and have people to go and talk to if you're having a bad day, or even if you want to catch up and talk about things outside of work on your days off. And everyone here is of the same mentality that we're all here to help each other and help make each other better. And I get that sense from my co-interns as well.
Providence, I found the downtown life, but also the ability to get out to nature very quickly, and especially after long days. It was really nice to go for a walk on the beach or go to a trail. Brown is a place where there's a lot of good community, and that's what's made it special for me. I found a group of friends. We've learned together, we've toughed it out together, and I think everyone appreciates growing together.
What this program does really well is it creates a space for you to explore. I've never felt funneled into one specialty, one idea of what a career could look like in medicine. And so because of that, I have a lot of room and I have a lot of elective time and just mentorship that pulls me in a lot of different directions. I take my unsureness about the future as positive because I think it means I'm enjoying a lot of things here.
I'm actually also part of the clinical educator track. So we have these once a month Friday sessions where we talk about how to be an educator, whether it's giving feedback, creating a chalk talk. It helps to build that role of an educator for our med students as well as our interns, and how that can be a role in our careers going forward.
So I initially knew that I was interested in oncology. I came here and I was able to get put in touch with Dr. Graff over at breast cancer. Within weeks, I was meeting with her, and she leads the breast cancer program, and it was just incredible that she was so accessible. I think here, just really spaces to grow, and it's so important that folks that come here want to see themselves grow and accept and embrace that growth potential.